Today I'm going to talk about urinary tract infections. This is another very common infection that most people have heard of and thought about, but are a little bit mystified by because they don't really understand the mechanics of it. So urinary tract infections have to do with infections of the bladder and the kidneys, basically. We call the kidneys kind of the upper tract and the bladder the lower tract. So just a little bit of anatomy. Humans have a tube that goes from their bladder to the outside world. It's called the urethra. In males, it's long. In females, it's short. And then from the bladder, there are tubes called the ureters that go into the kidneys on both sides. So when people get a urinary tract infection, we're usually talking about a bladder infection or cystitis. More common in females, they have a lower route for bacteria that live on the skin, around the anal area to traverse, to go up, than a male who has a much longer urethra. And when it infects the bladder, people get symptoms like burning, urinary frequency, having to go to the bathroom a lot, an urge to go to the bathroom, sometimes blood in the urine, sometimes discomfort over the bladder. And when it goes up into the kidneys, they may get fever, chills, flank pain, nausea, vomiting. It can be much worse and more complicated when it's in the upper tract. The most common bacteria that causes a urinary tract infection is usually E. coli, which lives in our stool and finds its way into our urinary tract. Now, lots of people that are older may have bacteria in their urine normally without any symptoms, or their urine might look inflamed when you look at it under a microscope all the time. So it's really the symptoms that drive the diagnosis of urinary tract infection, because there are people that are asymptomatic and they don't merit any specific treatment. So what do? Someone has symptoms, we do a urine analysis. That urine analysis gives us an idea, is the urine inflammatory or not? And that urine is also sent for culture where they try to grow the bacteria. And in the interim, antibiotics are started. And it's usually a short course, 3 days or so for females, maybe longer for males, because sometimes the infection could involve the prostate or could be more complicated than the male. This is when it's in the bladder. If it's in the kidneys, it's going to be a longer course of treatment, sometimes requiring a hospitalization if a person is vomiting or if they're really systemically ill. There are things that may have an impact. So for example, if your urine is very acidic or has certain chemicals in it, it may make it harder for bacteria to stick there. That's the idea behind cranberry juice, which has mixed data. But urinary tract infections are very common. They're often misdiagnosed and overdiagnosed, and sometimes a cause for unnecessary antibiotic use. But understanding the anatomy and what's going on, I think, helps people to really understand what happens when someone has a urinary tract infection.